Namaskara. My name is Dr. Harihara Murthy. I'm practicing in Bangalore as an ENT specialist for more than 3 decades. Allergies are some very common symptoms people encounter, and today the number of people having allergies is more than ever before. The physical causes for allergy is the body's reaction to something that it cannot accept adversely. Commonly seen allergies are for things in the house dust mites, animal dander, cockroach droppings, etc. Apart from that, seasonal allergies can be for different pollen, different kinds of weeds, grasses, flowering plants, etc. The pollen from these plants being seasonal, you can get seasonal allergy if you're susceptible to any of these things, as a result of which symptoms can be severe during those particular months. What does one encounter? Itching in the eyes, nose, throat, watering of the eyes, sneezing, watery discharge, nasal obstruction, breathing difficulty, sleep disturbances. Apart from that, people can also get cough and, in severe cases, wheezing and asthma aggravated by allergies. Sometimes intestinal allergies can be there, giving rise to other gastrointestinal symptoms. So identifying the allergen is important to find out and treat that particular problem. In the initial stages, symptomatic treatment and generic treatment for allergies with either tablets, syrups, or nasal sprays are usually sufficient to take care of the allergic manifestations. Allergies can cause severe symptoms which need to be addressed, and that is why medication is given. Medication may be given for the period of time that the allergy lasts. In a seasonal allergy, symptoms can be there for the period of the allergen load. So, that particular time, one can give the medication for a couple of weeks to a couple of months to ensure that you tide over the challenges of that period. Thereafter, they may not be required, and then they can be weaned off for a period of time. But in perennial allergies, identifying the allergen is critical so that we don't give medication for long periods of time and put the patient on medication that can be avoided. So for that reason, identifying the allergen is very important. The gold standard would be the skin prick test to identify the allergen on the patient's own body. By challenging the skin with a test by pricking the skin with the allergen, as a result of which you get a reaction if the person is allergic. That is an ideal thing to do. But in very small children, that may not be possible. They may not be conducive to getting themselves pricked multiple times. So in that case, we do the invitro test, which is a blood test. And the blood test also identifies the allergen with a fair degree of accuracy. So this identification is necessary to start the patient, if required, on a desensitizing program. Food you can avoid. Allergens from outside you can avoid. But what about allergens which are within the room? Many people use carpets, and carpets can harbor allergens. So if you are having problems within the house, within the room, then those things have to be dealt with differently. While housekeeping is a very necessary part of the plan, making sure that good housekeeping is done, vacuum cleaning is done, sterilizing of fomites like the curtains and bed covers, etc., soft toys as well for small children. These are things that have to be done. But having said that, we need to do a desensitization in those people who get perennial allergy. So in perennial allergy, we identify the allergen, like I said, and then we put them on a long-term immunotherapy program, which may last between 2 to 3 years. This gives small, slowly increasing, progressively increasing doses of the allergen stimulus, as a result of which they build their own immune system to work against that allergen and protect the body. So the reaction that they got earlier as a hypersensitivity is dulled to protect themselves from reacting to it, as a result of which the allergen is kind of stopped from causing a problem. So this can be either by injection or by a sublingual immunization. Sublingual is like polio drops put under the tongue regularly to build the immunity of the person. All these are long-term solutions which can be tried and effectively used. Symptomatic treatment may be required in the interim period, even in perennial allergies, but ensure that these things can be dealt with comprehensively only. It's not that one thing will work. Housekeeping is necessary. Protecting yourself from allergens is necessary. Ensuring that you take the right kind of medication at the right time is necessary. Building your immunity is necessary. Last but not the least, people who are very hypersensitive to different things in their lives, people who have an aversion to a lot of things or people or situations in their lives, they are also prone for allergy. The jury is still out on how effective this is in causing allergy, but nonetheless, in our experience, we've seen that those people who have these kind of aversions to a lot of things in their lives are more prone for allergic manifestations. So it's worthwhile remembering that health is a state of mind over matter.